Anatomy of the rectum. The rectum is the distal portion of large intestine between the sigmoid colon and anal canal. So here we can see an image of large intestine where the rectum is here. This is the sigmoid colon. And terminally anal canal. So in Latin the word rectum means straight, but the rectum is straight in quadrupeds but not in humans. So the rectum derives from endoderm. Although the rectum is considered as a part of large intestine, it is devoid of Taenia coli, seculations and appendices epiploicae, which are the cardinal features of large intestine. And it is 5 to 7 inches in length, that is approximately 12 to 15 centimeters in length, and lacks well-defined mesentery. So here is the sagittal section of female pelvis showing rectum. This is uterus. Vagina, urinary bladder, so in women, anterior aspect of the rectum is in close proximity to the posterior aspect of vagina and uterine cervix. So we can see it is anteriorly, it is related to vagina and cervix of uterus. This is rectum. So in men, it is behind the bladder and vas deferens, seminal vesicles and prostate. So vas deferens continues to form common ejaculatory duct within the prostate. So these are the anterior relations of the rectum in men. The diameter of the rectum is not uniform in its length. Its upper part is approximately 4 centimeters as that of the sigmoid colon. In the lower part, it forms a dilatation known as rectal ampulla. So this dilatation is the rectal ampulla, which is the most dilated part of the rectum. Here is the anterior view showing the rectum, anal canal and sigmoid colon. So this is rectum. So recto-sigmoid junction is indicated by the lower end of sigmoid mesocolon. So sigmoid mesocolon . So sigmoid mesocolon, it is peritoneal reflection. So the lower end or the distal limit of the sigmoid mesocolon indicates the recto-sigmoid junction, and lower distal limit of the rectum is indicated by dentate line. So this wavy margin is the dentate line. So the lower distal limit of the rectum is at the dentate line, and it is located in the middle of anorectal junction. So this line indicates the anorectal ring, that is the junction between the anus and the rectum. So the dentate line is also the point at which the columnar mucosa of rectum transitions to squamous mucosa of anus. The anorectal junction corresponds to the apex of prostate in males. So interior of rectum, permanent folds which are called as Hostan's valves. So the rectum has 3 lateral curves corresponding to the valves or folds, mucosal folds, which are called as Hostan's valves. So here is the anteroposterior view of rectum, where the interior of rectum is shown, showing the folds inside the rectum called as valves. So they are the Hostan's valves. So according to Houston, they are 4 in number and they are numbered from above downwards. First fold is the upper fold, lies near the upper end close to the recto-sigmoid junction. So here is the first fold. So the first fold is located at the recto-sigmoid junction. It projects from the right or left wall. So it is not a constant in position. It can be from right side wall or left side wall. So this side is the right side. This is the left side. The second fold lies about 1 inch, that is 2.5 centimeters, above the third fold and projects from the left rectal wall. So this is the second fold, which is usually located on the left side. So it is projects from the left rectal wall along the concavity of the upper lateral curvature. Next, about the third valve, it is the largest, most constant and most important valve. So the third valve, as it is quite prominent and conspicuous, it projects from the anterior and right wall of the rectum along the concavity of the middle lateral curvature. It lies at the level of upper end of ampulla. So this is ampulla. So it lies at the level of upper end of ampulla. And clinical significance of this third valve, that is the semilunar transverse folds of the rectum or the rectal valves, particularly the third valve, causes the hindrance in passing the any instrument from anus. So therefore, the cannula for rectal washing or sigmoid scope is usually passed in the left lateral position of the patient to avoid injury to Hostan's third valve or avoid unnecessary discomfort to the patient. So coming to our last valve, that is the fourth valve. So the fourth valve projects from the left wall of the rectum along the concavity of the lower lateral curvature. It lies about 2.5 centimeters below the third valve. So it is located 2.5 centimeters below the third valve. Fascia propria. Fascia propria is an extension of pelvic fascia and encloses the rectum, adipose tissue, blood and lymphatic vessels. It is more pronounced laterally and posteriorly and forms the lateral ligaments of rectum. In 25% of the patients, the lateral ligaments contain the branches of middle rectal artery and venous plexus. The rectum is not suspended by true mesentery, that is, it is not suspended by 2 layers of peritoneum that suspend an organ. The mesorectum is perirectal areolar tissue that is thicker posteriorly and contains the terminal branches of inferior mesenteric artery. Curvatures or flexures of the rectum. Rectum has the curvatures in both anteroposterior and lateral planes. So anteroposterior planes, there are 2 in number. the upper sacral curvature and lower perineal curvature. So here is the sagittal section to demonstrate the anteroposterior curvatures. So the sacral curvature corresponds to the concavity of the sacrum and coccyx. So here is sacrum and coccyx. So the curvature of the rectum along the sacrum and the coccyx. So this curvature is called as sacral curvature. The next one is the perineal curvature. It corresponds to the forward bend of anorectal junction and it is maintained by puborectal sling, which is derived from levator ani. So here is the anal canal. So anorectal junction. So forward convexity. So perineal curvature corresponds to the forward bend of anorectal junction and it is maintained by anorectal sling which is formed by levator ani muscle. So this is the levator ani muscle. So here is another image which demonstrates beautifully the sacral curvature and perineal curvature. So here is the sacrum and coccyx and the curvature along the sacrum and the coccyx with forward concavity is the sacral curvature. And this forward convexity curvature is called as perineal curvature. Next, regarding the lateral curvatures, the lateral curvatures are well appreciated in anteroposterior view. There are three lateral curvatures which are present in the form of two convexities on the right side and one convexity on the left side. So, this is the right side, left side of the lesser pelvis showing. So, this is the first convexity on the right and towards the left there is only one convexity. So upper lateral curvature is the convex towards the right at the junction of S3 and S4. So at the junction of S3, S4 we find the upper lateral curvature. Middle lateral curvature is the convex towards the left at the sacrococcygeal junction and it is most prominent curvature. So the middle is towards the left and it is at the sacrococcygeal junction. And it is the most prominent curvature. And the lower curvature is convex to the right at the level of tip of the coccyx. Peritoneal relations of rectum. Upper one-third of the rectum is covered by the peritoneum from the front and from the sides. So we can see the peritoneum covering upper one-third of the rectum. So we can see the peritoneal reflection which is along the upper one-third and side, and middle one-third of the rectum is covered with the peritoneum only from front. So upper one-third it is both anterior as well as on the lateral side, and middle one-third it is only on the anterior aspect. So we can see it is only on the anterior side, middle one-third. And lower one-third of the rectum, the ampulla is not covered by the peritoneum at all. So the lower one-third is completely devoid of peritoneum. So let's see the relations of rectum. Anterior relations. Upper two-thirds of the rectum, that is, it is covered by the peritoneum, peritoneal relations. So in males, it is related to rectovesical pouch and coils of the small intestine and the sigmoid colon within it. So you are seeing a male pelvis sagittal section. The peritoneal reflection between the rectum and the urinary bladder is the rectovesical pouch. And this rectovesical pouch contains the coils of small intestine and sigmoid colon. And lower one-third of the rectum, so that was about the upper two-thirds, so from here to here, and lower one-third means below this lower one-third. So lower one-third anteriorly, it is related to the base of the urinary bladder. So we can see the base of the urinary bladder. Base of the urinary bladder, and it is related to ureters. That is the terminal parts of the ureters, and it is related to the seminal vesicles. It is related to the ampulla of vas deferens. And it is also related to the prostate. So all these structures are separated from the rectum by well-defined rectovesical fascia of Denon-Villiers. So below the rectovesical pouch, the peritoneum continues below it as a fascia like a septa which separates the rectum from all its anterior relations. So anteriorly, upper two-thirds of the rectum is related to rectovesical pouch, which contains the coils of the small intestine and sigmoid colon within it. And below the two-thirds, that is the lower one-third of that rectum, it is devoid of peritoneum, and it is related anteriorly to the base of urinary bladder, ureters, that is the terminal part of the ureters, seminal vesicles, ampullae of vas deferens, prostate, and all these structures are separated from the rectum by means of a facial septa called as rectovesical fascia of Denon-Villiers. Let's see the anterior relations of rectum in females. Anteriorly, it is related to rectouterine pouch. So the pouch between the rectum and the uterus. So here is the uterus and the rectum. So the peritoneal reflection between the uterus and the rectum is called as rectouterine pouch, and which contains the coils of small intestine and sigmoid colon within it. And lower part of the rectum, that is the lower one-third of the rectum, in females it is related to lower part of vagina. It is related to vagina, and it is separated from the vagina by means of a ill-defined rectovaginal fascia. So the fascia separates the vagina and the rectum is called as rectovaginal fascia. So the posterior relations of rectum are same in both males and females, and in the midline posteriorly it is related to lower three pieces of sacrum. So this is first, second, third, lower three pieces of sacrum, which we can number it as third, fourth and fifth pieces of sacrum, and it is related to the coccyx, and it is posteriorly in the midline related to anococcygeal raphe. That is the connection between the coccyx and the anal canal is the The fibrous connection between the anal canal and the coccyx is the anococcygeal raphe, and it is also related in the midline to the ganglion impar and medial sacral vessels, superior rectal artery opposite to the level of S3 vertebra only, and it is also related to fascia of 𝐒𝐽𝐴. So the fascia separating it posteriorly from the sacrum is the fascia of 𝐒𝐽𝐴. So these are the midline relations on posterior aspect. So here is the pelvis after removing the rectum and the urinary bladder in males to show the lateral relations, that is the posterolateral relations of rectum. So posterior relations on each side of the midline. Rectum is related to piriformis coccygeus. So here is the piriformis. So we can see the piriformis gaining its origin from the pelvic surface of the sacrum. So piriformis is related, the rectum is removed, so you can imagine it is related to piriformis, and the lower part it is related to coccygeus. And it is also related to levator ani, which forms the pelvic floor on posterior inferiorly on each side, and it is related to sympathetic chains . So you can see the two sympathetic chains which are present posteriorly on each side of sacrum, that is the center part of the sacrum, and it is related to anterior primary rami of S2, S4, S5 and coccygeal nerves. S2, S4, S3, S4, S5 and lastly the coccygeal nerve. And it is related to pelvic splanchnic nerves and lateral sacral vessels. So pelvic splanchnic nerves and also related to lateral sacral vessels. So these are posterolateral relations, means the relations which are on the posterior side on each side of midline of rectum. So the 𝐒𝐽𝐴's fascia, it is the presacral fascia presence between the rectum and the sacrum. So what you are seeing between the sacrum and the rectum, the fascia where the rectum is not directly in contact with the sacrum, in between the fascia is called as 𝐒𝐽𝐴's fascia. Blood supply which enters the rectum from posterior aspect. So the upper rectum is supplied by superior rectal artery, which is a branch of inferior mesenteric artery. So superior rectal artery. So here is the inferior mesenteric artery. And the middle portion of the rectum is supplied by middle rectal artery, which are usually 2 in number, and is a branch of anterior division of internal iliac artery. So here is the internal iliac artery. So this is the anterior division of internal iliac. Internal iliac artery. So from the internal iliac artery we can see a branch which is called as middle rectal artery. The lower portion of the rectum is supplied by inferior rectal arteries, which is a branch of internal pudendal artery. So they are also 2 in number which supply on each side of the rectum. So they are the branches of internal pudendal artery. And one more vessel which is called as median sacral artery, which is a direct branch of abdominal aorta, also supplies the rectum. So we can see the inferior mesenteric artery, which is a branch of abdominal aorta, which gives rise to superior rectal arteries. So superior rectal arteries are the branches of inferior mesenteric artery which supply the rectum. And middle rectal arteries, they are 2 in number which supply from each side of the rectum. And middle rectal arteries, they are the branches of anterior division of internal iliac artery. And inferior rectal arteries, they are also 2 in number and they are the branches of internal pudendal artery. Internal pudendal artery is in turn a branch of internal iliac artery. And next about the median sacral artery. Median sacral artery is the direct branch of abdominal aorta, we can see here, and where it supplies the posteriorly the rectum. So this is the blood supply of rectum. So here is the posterior view of the pelvis where we can see the blood supply of rectum. So venous and lymphatic drainage, the pathways for the lymphatic and the venous drainage of the rectum. Let's see how it is cephalad and lateral in direction. So the lymphatic drainage of upper 2/3 of the rectum is along the pathway of superior hemorrhoidal vein. So here is the superior hemorrhoidal vein. And cephalad to inferior mesenteric nodes. So inferior mesenteric nodes which are along with the inferior mesenteric artery and vein, we can see here. So this is abdominal aorta. This is inferior vena cava and this is the inferior mesenteric artery. And this is inferior mesenteric vein. So these are the inferior mesenteric nodes. The lymphatic drainage of the lower third of the rectum is cephalad as well as the lateral along the middle hemorrhoidal veins to the internal iliac nodes. So there is no communication between the inferior mesenteric and internal iliac lymphatics. We can see that there is no communication between the inferior mesenteric and internal iliac lymph nodes. In women, the lymphatic drainage above the dentate line also includes the posterior wall of vagina and reproductive organs. Below the dentate line, the drainage is along the inferior rectal lymphatics to the superior inguinal nodes along the pathway of inferior rectal artery. So along the pathway of inferior rectal artery, it is to the superior inguinal nodes. So the innervation of rectum, the sympathetic fibers are derived from L1, L2 segments of the spinal cord and parasympathetic fibers are derived from S2, S3, S4 segments of spinal cord. So L1, L2 gives rise to sympathetic segments and parasympathetic are from S2 to S4 segments. So all the pelvic nerves lie in the plane between the peritoneum and endopelvic fascia and can be injured or transected during rectal dissection. So the preganglionic fibers via the sympathetic nerves follow the branches of inferior mesenteric artery and superior rectal artery to the left colon and upper rectum. So the presacral nerves, which are the fusion of aortic plexus and lumbar splanchnic plexus, innervate the lower rectum. So just below the sacral promontory, the presacral nerves form hypogastric plexus. So these are the hypogastric plexus. So the main hypogastric nerve enters the rectum laterally and carries sympathetic innervation from the hypogastric to the pelvic plexus, located on the lateral side of the pelvis adjacent to the lateral stalk at the level of lower rectum. Next, regarding the parasympathetic plexus, they emerges from the sacral foramina and joins the sympathetic hypogastric plexus to form the pelvic plexus. So they all join to form the pelvic plexus. Postganglionic parasympathetic and sympathetic nerves are distributed to the left colon and upper rectum via the inferior mesenteric plexus and directly to the lower rectum and upper anal canal. Let's see the supports of rectum. The rectum is kept in position, prevented from the prolapse by the following structures. One is the pelvic diaphragm. So here is the pelvic diaphragm, which is formed by the coccygeus and levator ani. So here is the cut part of rectum. So it supports from below. And the next support is the fascia of Waldeus. It is the connective tissue behind the rectum. It contains perirectal fat. So we can see the perirectal fat. It contains lymph nodes, lymphatics and superior rectal vessels. So this is a superior rectal vessels, and we can see the lymphatics, which are shown in green color. So the fascia of Waldeus also supports the rectum and preventing it from prolapse. Then lateral ligaments of rectum. These are the fibrous bands formed by the condensation of pelvic fascia on each side of the rectum. So they attach the rectum to the posterolateral walls of the lesser pelvis and contain the middle sacral vessels. Next is the rectovesical fascia of Dinon-Villiers. So here is the fascia of Dinon-Villiers. So rectovesical fascia of Dinon-Villiers, and the reflection of pelvic fascia from the parietal to the visceral layer around the rectum. So we can see the reflection of peritoneum. So the reflection of pelvic fascia from the parietal to the visceral layer around the rectum, and pelvirectal or ischiorectal fat which is surrounding on either side of the rectum act as a loose packing material around the rectum and the anal canal. Next, the next support is the pelvic peritoneum and related vascular peduncles. And this rectum from below, it is supported by perineal body as well. So here is the perineal body. Which supports the rectum. Next, we shall see the microanatomy, or histologically the rectum has similar layers as rest of the large intestine, like mucosa, submucosa, muscularis and serosa or adventitia. The mucosa has a simple columnar epithelium with numerous goblet cells, and at the anal transitional zone, the columnar epithelium flattens gradually and becomes a stratified squamous non-keratinized epithelium. So below the epithelial there is a connective tissue layer called as lamina propria, which has blood and the lymph vessels, and a layer of muscle called as muscularis mucosa or lamina muscularis mucosae. Next is the submucosa. The submucosa contains loose connective tissue with blood vessels, lymph follicles and the mucinous plexus. It has a dense network of veins which are called as rectal venous plexus. The muscularis layer has inner circular and outer longitudinal musculature which forms Auerbach's plexus. So between the inner circular and outer longitudinal muscular layer, the plexus of nerves are called as Auerbach's plexus. So that is about the histology or microanatomy of rectum. Applied and surgical anatomy of rectum. So the location of rectal cancer is identified by its distance from the verge rather than the dentate line. So the lower distal rectal cancers are located 4 to 8 mm from the anal verge. Middle rectal cancers, they locate usually 8 to 12 centimeters from the anal verge. And upper rectal cancers, so here are the middle rectal lesions, and we can see middle, lower and upper in this image. Upper rectal cancers or proximal rectal cancers, they are usually 12 to 15 centimeters above the anal verge. However, the surgical decision making for sphincter preservation is dependent mostly upon the distance from the lower border of the tumor to the top of the anorectal ring rather than the anal verge. The rectum occupies the sacral concavity and ends 2 to 3 centimeters proximal to the tip of the coccyx. So the presacral fascia covers the concavity of the sacrum and coccyx. So presacral nerves, middle sacral artery and presacral veins. So these are the structures which are present in the fascia of Denon-Villiers, which is contains the loose connective tissue between the sacrum and the rectal wall. And this plane should not be violated during pelvic dissection, as life-threatening hemorrhage from the presacral venous plexus can occur. So we can see lot of veins present in the presacral, forming presacral venous plexus. So these plexus may rupture during removal of rectum. So that is the reason the surgeon should take utmost care of presacral fascia. So this completes the anatomy of rectum with histology and clinical aspect. Thank you.